Aha.
All right.
Okay, so we're ready to go. So the first thing I wanted to do was to show you a draft notional timeline of the three streams that will be working together to implement two important decisions from the Health Assembly. The first in purple here at the top is the PIP decision 7212. And you'll see that we've started to fill in some boxes with governing body meetings, with different consultations. The second stream is the stream on Nagoya and public health, and this is decision 7213. And we've, again, filled in some very notional boxes with governing body meetings. And then the third that will be looked at and is very important for the work that we do is what's happening in the context of the CBD and Nagoya Protocol. So there you'll see that there are a few boxes that we filled in with different types of meetings that are already planned. So we would consider this to be a dynamic timeline, a dynamic series of events, and it will be updated as we have more information, but we thought it would be useful to see that there will be coordination amongst the many stakeholders that are relevant to implementing these decisions. So turning to 7212, which is about PIP framework, we have developed a high-level work plan that addresses each WHA request, and we will be engaging as necessary with relevant key partners that include member states, GISRIS, CBD Secretariat, and other relevant international organizations, and then other relevant stakeholders, including manufacturers, civil society, databases, and initiatives. Throughout it all, we will be coordinating very closely across the organization, three levels to ensure harmony and consistency with implementation of Decision 7213 on Nagoya Protocol and public health. So turning to the first of the OPs, the operational paragraphs from the Health Assembly decision, this is OP1A, it's on virus sharing. A summary of the WHA request was that WHO work with GISRIS and relevant partners to collect, analyze, and present data on influenza virus sharing in order to enable a deeper understanding of challenges, opportunities, and implications for public health. As well, the DG was asked to identify specific instances where virus sharing has been hindered, and finally, how these hindrances may be mitigated. So in order to implement this, we have the privilege of having Jackie Katz, who's the former director of the US CDC Collaborating Center in Atlanta, and she will be helping us to implement this decision. And obviously, Wenqing Zhang and her team with the Global Influenza Program will be instrumental in this as well. So with them, we've thought of a series of phased approach to implementing the decision. And the first phase would really be about information collection. There will be a survey developed or some other mechanism as necessary to gather information on influenza virus sharing from GISRIS labs and other relevant partners, with a view to allowing a deeper understanding of the challenges that are facing virus sharing, including instances where virus sharing has been hindered. And we will also be soliciting input on ideas to mitigate these hindrances and opportunities to strengthen virus sharing under GISRIS. So that's the first phase, which should take us through about January or so. In phase 2, will be an analysis conducted by WHO, and we will review the evidence and information collected. We'll develop some preliminary findings, and these will be shared with GISRIS. And then finally, phase 3, there will be preparation of a report for Health Assembly 73 next May, and that report will have a summary document and some data analysis. So that's for OP1A. OP1B, I'll turn the floor to my colleague, Steve Solomon.
Thank you, Anne. And before I begin, let me just extend greetings to the members of the advisory group, to the chair, to our colleagues from GISFRIS, and to all those who are joining us through the webinar. And just to echo what Sylvie said, we hope this will prove an effective way to further increase and improve our transparency and getting information available and out to all those who are interested. There's a broad range of communities interested in this subject, and we really do welcome feedback on how this, because it's the first one, how this works and how we might improve it over time. So just to situate us again, we are now sort of walking through WHA 7212, the PIP decision. It has several operative paragraphs, OPs we call them, and we've just heard about OP1A, and now continuing our walk through the decision, we're going to go through OP1B. And OP1B provides that it gives us a mandate to prepare a report with inputs from member states and stakeholders on the treatment of influenza virus sharing and the public health considerations thereof by existing relevant legislation and regulatory measures. This is very broad, so there was a follow-on reference to including those implementing the Nagoya Protocol, and to do all of this in consultation with our colleagues at the Convention on Biological Diversity, which is very important to this work. So this is our mandate, and the next slide will show you how we are going about filling this out, and then I will have a few brief words to give you sort of the context, how this is positioned in the Nagoya Protocol. So there will be a two-phase desk review. I think it's worthwhile starting out with some figures now. There are currently 119 Nagoya parties. The most recent party was Maldives became a party on the 29th of September. So there's 119 parties. We're aware of 11 member states of WHO who are not yet parties to the Nagoya Protocol, who have their own ABS legislation. So there may be more as we learn more, but at a minimum now we have 130 legislative or regulatory or policy frameworks to look at. Most of them should be on the clearinghouse because they should be under the Nagoya Protocol reported to the CBD Secretariat. So phase one is to look at to look at that work, that body of work, see how they are considering pathogens, how they consider influenza, both seasonal and pandemic, and particularly look for whether there are express references to the PIP framework, to the international health regulations, and the potentially significant articles, relevant articles of the Nagoya Protocol. And these include, but are not limited to, the Article 4.4, which deals with specialized international instruments. There are other relevant articles which address other areas for special consideration of types of genetic resources, but also Article 8b, which is the article in the Nagoya Protocol which deals with, among other things, health emergencies and making special provision to allow for the speedy sharing of pathogens in particular during health emergencies. And looking at how countries have implemented those will be part of this phase 1A of the desk review. The other part of this desk review will look at legislation databases for ABS legislation using these same parameters, but looking more broadly. So we want to make sure we have as global a picture as possible of the range of legislation or regulatory frameworks. There will also be, and this is an area where work is in progress, you saw the slides with the multiple streams, working with our colleagues in those other streams, to consider the possibility of a survey to member states, just to make sure we have the material we need to have. Where there is not information in the clearinghouse database, for example, countries often post their legislative and regulatory schemes on the internet. They're not always translated into one of the 6 UN languages. That presents problems. Accessing those in ways that we have reliable information is an issue. So we may need to add to a survey of member states just as a check on that. And then the final box here is to report on findings, and the date there that will be important for those listening will be the May 2020, next year's Health Assembly, when we hope to have, at a minimum, results from the desk review, and if we can, and if we do contribute to a survey, hopefully some results from that, if only preliminary. So that is how we are looking at OP1B of the decision WHA 7212. And just again to sort of ground this in the Nagoya Protocol, the relevant article here is Article 15 of the Nagoya Protocol. Article 15 is the article which provides that each party shall take appropriate, effective, and proportionate legislative, administrative, or policy measures to provide that genetic resources utilized within its jurisdiction have been accessed in accordance with the prior informed consent and mutually agreed terms that the Nagoya Protocol requires. Essentially, that's saying there is a requirement, a key requirement of the Nagoya Protocol to provide for domestic implementing legislation. That is how this international obligation is translated to the national and to the exchange environment for all genetic resources. So that is the relevant article we are dealing with, and determining how exactly these 119 Nagoya, as well as other countries, may be working on their ABS legislation was obviously important to member states in figuring a way forward, and this is the basis for the mandate that the Health Assembly has provided us that we are working on fulfilling under this paragraph. So maybe I'll stop there, and I know there'll be questions after, time for questions afterwards, and you will get to hear from another member of the Secretariat here, in this case particularly the PIP Secretariat. Dan Hugendubler will continue our walk through the operative paragraphs of the decision.
Thanks very much, Steve. So I will continue the walk through the decision with the OP1C. And this is about the prototype search engine. And what the Health Assembly requested is that the Secretariat provide more information on the functioning, usefulness, and limitations of this prototype search engine. Just to give you a bit of context, the search engine was developed at the request of the advisory group to identify end uses of genetic sequence data from influenza viruses with human pandemic potential. We've been working with our colleagues from the World Federation for Culture Collections and the World Data Center for Microorganisms who helped us to develop this the search engine. And it looks at a variety of sources such as patent applications, regulatory filings, clinical trial data, and academic literature to identify uses of IVPP GSD. So what we plan to do is to conduct a review and look at these 3 aspects of the search engine that the Health Assembly requested us to look at. So first, on the functioning, we're planning to provide information on the databases that are searched, which search terms are used, how the data is processed and presented, and also questions of data ownership that have come up. Second, on the usefulness, we're going to present results of a pilot of the database that was presented to the advisory group, and we'll also provide information on how the database could be used in the future. And finally, on limitations, we'll provide information on what can't be obtained from the search engine, and we'll also explain where human intervention is needed. So, for example, going through the results to find useful information. And throughout this process, we're going to work very closely with our partners at the World Data Center for Microorganisms and the World Federation of Culture Collections. Oh, yeah, sorry. And this is the partners I was mentioning. So if we turn to the next paragraph, which is on awareness raising, the Health Assembly asked us to gather information from member states and stakeholders to look at possible next steps to first raise awareness of the PIP framework among databases and initiatives, data providers, and data users. Second, to promote acknowledgement of data providers. And then third, to promote collaboration between data providers and data users. So on this item, we're still working to develop an action plan and list of activities, and these will be shared in advance of the executive board meeting in February. And then finally, from my side, on OP1E, member states requested us to continue to provide information on new technologies and new challenges and opportunities posed by new technologies. So on this, we are working with our partners to identify new technologies as relevant. One relevant development that has happened since the Health Assembly is a technical consultation that was held in June of this year on better global tools for influenza prevention, control, and treatment. And at this meeting, there were a number of new technological developments that were discussed, and we'll share the meeting report from this with you in advance of the executive board. So I'll give the floor back to Anne to discuss OP2 now. Thanks.
So the last OP, the last operational paragraph, has to do with an amendment to the framework, rather historical. Footnote 1 of Annex 2 was amended, and the Health Assembly decided to revise it with effect from the closure of the 72nd Health Assembly. So what was this footnote about? Basically, the background was to make sure that there was a perception and reality of fairness and equity in benefit sharing when it comes to the use of PIP biological materials. So basically, the Health Assembly wanted to make sure that any entity that could use PIP biological materials was tasked and approached by the Secretariat for benefit sharing under an SMTA2. So they circumscribed this to make it consistent with the rest of the PIP framework obligations, and basically they said any manufacturer that enters into a contract or formal agreement with a GISRIS laboratory or another recipient of PIP biological materials for the purpose of using PIP-BM on the manufacturer's behalf for commercialization, public use, or regulatory approval of that manufacturer's vaccines should be approached by the PIP Secretariat, by WHO, and should sign an SMTA2. So that's the idea behind the footnote. And in terms of the steps that have been taken by the Secretariat to date, so we have already worked with GISRIS to revise the shipping notice that accompanies a shipment of PIP biological materials. And basically, all recipients of PIP biological materials will now be made aware that there is a change to the use of PIP biological materials by them on behalf of entities that request them to test products for them. So basically, the notice has been revised, and users of PIP, indirect users of PIP biological materials, will now be informed that if they choose to send their vaccines or diagnostics or pharmaceutical products to a recipient of PIP biological materials, they will be put on a list, and WHO will be informed about this use of PIP biological materials on their behalf. So we are just in the process of finalizing the shipping notice, and it will start being used, I think, very soon. We've also revised the SMTA2 templates. As you may imagine, we have some templates that we use for the different categories of SMTA2s, and they've been updated in order to make sure that this change to the definition of recipients is clear. We are also working to make sure that we inform current signatories of SMTA2s that the definition of recipient has changed, and we're in the process of working out how to do that as efficiently as possible. We're also revising the Purple Book. That needs to be done in all 6 languages, and we're underway to do that. we anticipate that it will be available in all languages by the end of 2019. And we're updating the PIP webpage to make clear that there has been a change to the PIP framework Annex 2. So next steps, there will be an information session for member states on implementation of the two decisions, the PIP decision 7212 and the public health implications of implementation of Nagoya 7213. That will take place on November 1st here at HQ. That is an information session that is limited for member states. The Secretariat will continue to report and will issue its report on progress to the Health Assembly in May next year through the Executive Board in February 2020. And we will be completing the steps on OP2, the SMTA2 amendment, very rapidly. If you wish to go find more information about any of this, you have some key links here. And with that, I will stop and see if there are questions. And I think we are able to receive questions through the WebEx online, through the chat function. So if anyone has questions, please do send them and we'll try to answer them now. So it doesn't seem we received any questions on the WebEx yet. Are there any questions here from the PIP advisory group or GISRIS members? Thank you. Dr. Raman, please. Thank you.
I don't know how relevant this is. What happens if a universal influenza vaccine comes? How can we deal with that?
That's a great question. I don't have the answer right this minute. Let me say some thoughts. The universal health vaccine would be both a seasonal and a pandemic, I assume. So under our SMTA2s, we do have commitments to provide to WHO access to pandemic vaccine. To the extent that we could call the universal vaccine a pandemic vaccine, I think we could have access to some of that. I would turn to my legal counsel to see if he has anything to add on that. But I think that would be one of the approaches we would take in order to be able to have access to some of that universal vaccine. Do you have?
Sure. And maybe Sylvie wants to say something, but so I'll defer to Sylvie and then maybe add a few comments.
Yeah, I think there will be legal issues, but there will be also technical issues, and probably we would have to discuss also what is the definition of a pandemic in case we already have the vaccine, and because normally a pandemic is really when the population doesn't have immunity, so we will need to certainly to look at some technical aspects as well. And legally speaking, of course, it will have an implication on not only on when we declare a pandemic, but also on the agreement that have been previously signed, because we are still separating very strongly seasonal and pandemic influenza. So we don't know yet how much it will affect those definitions and consideration on the various situations.
Let me just say, sort of before giving some legal thoughts, that this would be, as saying as a lawyer, not as a scientist, this would be, it seems to me, a very, very good problem to have if there was a universal flu vaccine. That we hope there is such a problem that we can deal with, and I'm sure legally we will be able to deal with it, but the idea of being able to get one jab and then you're good for life, whatever comes round, seems like a great idea. it would be such a change from the underlying assumptions and framework for the PIP framework, though, that it would require really rethinking how we go about access and benefit sharing and preparation as in a sort of wholesale way. I think Anne's right that in some sort of transition phase into this, as we'd approach it, it may be that we would work with our partners on this and look for ways to ensure that the principles of PIP, those principles of fairness and equity, are fulfilled moving forward. But I think it would really require rethinking in a wholesale way how this arranged. And again, I think it would be a wonderful problem to have, and I hope we have that problem sooner rather than later.
Carrie Ann, please.
Thank you. A couple of questions, and thank you for the presentation. One is sort of just to make sure I have this straight. So there are going to be 2 reports and 2 surveys, a report for operational paragraph A, a report for operational paragraph B, and 2 surveys. I was just not clear on that, and I just wonder about how much surveying we do in terms of this topic, which is fairly complex. The other one is regarding the change in the language in Annex 2. I think there's the assumption is that whoever has received the PIP biological material then informs the manufacturer who has requested use of it that they need to sign SMTA2. Is that correct? I just wanted to make sure I understood it because I wasn't sure how that followed. Thanks.
So thank you. On the reports, there will be 1 report for Decision 12 on PIP, and there will be 1 report for Decision 13 on public health and Nagoya. In terms of the numbers of surveys, we are hoping to limit it to the least number possible, so that's still under debate whether there's 1 survey or 2 surveys. But there would be 1 report for each decision. So I guess, yes, 2 reports. But for PIP, there will be 1 single report. 1A and B will be in the same report. With respect to OP2, yes, the idea is that the recipient of PIP biological materials will have the obligation to tell us if they are using the materials on behalf of another entity. Professor Watson.
This may be a dumb question, and if you feel that it's more appropriately addressed at a later point in the week, then fine. But I just wanted to understand in relation to the second of the items, the one that you described, Steve, and the nature of the kind of a query and what you are expecting back and not expecting back from countries. So my understanding is that there are quite a number of countries around the world who are not signatories to Nagoya at all. And some of them have access and benefit sharing laws, and some don't. Then there are countries who've signed up to Nagoya, but haven't yet ratified. Then there are countries who've signed up to Nagoya, who've ratified, but not yet implemented legislation. And then finally, there are countries that are signed up, ratified, and have implemented legislation. So that there's that set. Among any of those, but particularly among the latter, those that are, done the whole Nagoya legislation implementation, am I right in understanding that there are some who say, fine, we accept Nagoya, we're signed up to it, and if we are receiving materials from another Nagoya signatory, we will do as is expected of us under Nagoya. But with respect to our own biological materials, we waive our rights under Nagoya. And so we will not expect other countries to take similar action if they receive materials from us. And in doing that, presumably make life much easier for the recipients of those materials, labs, etc. Will the kind of survey that you're going to do unearth that and enable us to know to what extent there are countries who, for all the Nagoya stipulations, in practice are actually waiving their rights either entirely or specifically in relation to pathogens?
Thanks. And the answer is yes, we hope very much that we will be able to unpack it. And you've done a very good job of laying out what the various sort of categories are. We hope to be able to unpack it. And remember, this is not a binary issue. It's not as if countries can choose to waive those requirements with respect to genetic resources or not. This is a spectrum. So each country can tailor their arrangements as they see fit. They can decide to waive with respect to some genetic resources and not others, with respect to pathogens, or some pathogens or all, or individual ones. These are all possible. And these categories are potentially significant. So you asked how many countries have joined Nagoya and ratified it, signed it, ratified it, and fulfilled the Article 15 requirement to implement legislation or regulations. That is a very good question. We are still looking for the figures on that, but roughly we think of the 119 parties, some 30 or 40% have done that last step, which is to say have implemented a regulatory or legislative scheme for purposes of implementing Nagoya. So it's a relatively small amount. That leaves a big uncertainty factor for the 60 to 70% of Nagoya parties that haven't yet done so, that are preparing their legislation. This is one of the reasons why discussion and conversation more broadly can be helpful, why awareness raising can be helpful, because you have the majority of Nagoya parties which are developing their legislation. There's an opportunity for lessons learned from their co-parties who have legislation and maybe thinking about ways it could have been improved or changed. But of those countries that are not parties to Nagoya, there are roughly, in terms of WHO member states, some 65 to 75. And it's rough because there's an overlap in some countries which have not yet joined Nagoya but are European Union member states. So they may have some obligations under the European Union implementing legislation, but yet they're not Nagoya parties themselves. But figure roughly 70 countries are not yet parties or not parties to Nagoya. They may have ABS legislation. For example, Brazil, India, they have Brazil has ABS legislation, not yet a party to Nagoya. It's very important to look at that legislation with these same parameters, and that's something we will do. But I think it's very helpful what you've laid out, these sort of categories of parties. And I could imagine even, and we may, following this this well-framed question, we may benefit from some sort of table that might show that at a glance, and with the numbers and what we know filled into each of the column blocks next to those different categories. So that's very, very helpful. Thank you.
So we have 4 questions on the web, coming from the web. I will ask Dan to read them, and then we have some more questions from Dr. Kwate Mancha. So Dan?
Sure. So I can, do you want me to read all 4, or do you want me to read?
Sure.
Okay. One by one.
Read all
Okay.
4 so that, yeah.
Okay, sure. So the first question is about paragraph OP1B, and the question is how we plan to address the regulatory measures aspect of that decision, because the comment was made that the decision is not limited only to Nagoya Protocol implementing legislation. And then a second question was on the role of stakeholders in the implementation of OP1C on the search engine. And then there was a question about how the implementation of the PIP framework and the new amendment will be followed up in developing countries, and especially in South America. And the final question is regarding translation of legal frameworks, are there any possible solutions?
So maybe I'll just take up questions, the first question and the last question, 1 and 4, because I think I can do so fairly briefly. In terms of looking at regulatory arrangements, I think the question, and if the questioner could, I invite the questioner to write back if this isn't what the aim was out of concern about differences between legislative measures and regulatory measures and finding them. That won't be a problem for Nagoya parties because whether it's regulatory or policy or legislative, Nagoya parties should be posting that with the CBD Secretariat. It could be a problem for countries which are not party because often countries may post their legislation but not always their regulatory arrangements. And even if they do post it, they may be harder to find. So that's just one of the confounding factors in the desk audit. And then could you just repeat the last question, Dan, again? Because that.
The last question was regarding translation of legal frameworks. Right. Are there any possible solutions?
There's a solution, although it's a fraught solution, and that's to use electronic translation services. It's fraught because you're dealing with legal language and using a less than ideal system for translation. I think, though, through you saw that some of the parameters include to determine whether the international health regulations have been mentioned, whether the PIP framework has been mentioned. So in these sort of larger issues, we would be able to do that with machine translation, but it may be difficult when it gets down to specifics about genetic resources and pathogen sharing, access and benefit, and MAT and PIC terms. So it presents a challenge, and we will report on those challenges and ways that we have dealt with them.
So there was the question on the role of the stakeholders in the implementation of OP1C, which is on the search engine. The answer to that is that in the first instance, we're planning to do this in collaboration with WDCM and WFCC because they are the ones who can give us the information about this feasibility. And then once we finish that stage, I think then we'll see if it's useful at that stage to include a broader range of relevant stakeholders in the process. So that's a bit TBD right now.
And then I can address the the follow-up for the new amendment. We are following up with all signatories, current signatories. So we've signed about 83, 84 agreements, and there are about 13, I think, in category A, which are the vaccine and antiviral manufacturers. There's, I think, 2 in the diagnostic sector, and then the rest, about 77, I think, are academic and other types of institutions. We are finding a way to approach each entity that has signed in order to make them aware of the changes and to make sure that if they are indeed engaging in some work for third parties, that work would have to be communicated to us, or the entity for which they are performing the work would have to be communicated to us. So we are in the process of finding an efficient way to do this without reopening every single agreement that has been signed, and we are working closely with the legal department to do this. I don't know if there's a specificity, and if the person who asked the question wants to follow up to the Latin America sector or Latin America region, let us know, and I can see if there's anything that we should do about that. Over to Dr. Cuauhtemoc Mancha, please.
Thank you. Two comments. One is related to the opportunity to have all the information now, after I don't know how many years, in order to update the Purple Book. This is something really important, I consider, and thank you, the Secretariat, for that kind of work you're doing, because it's really important to put things together in here. And on the other hand, the second commentary is related to the Nagoya Protocol and the implementation of different aspects, because I haven't heard that if there are some other groups working with us, seems like the PIP or the Secretariat are just alone doing this. And for sure that under the umbrella of the United Nations organization, there will be someone else doing this kind of work. And probably the survey might be working with them, sharing our thoughts on that, and see what are they thinking about in order to keep going on that in the same way as the United Nations organizations. Thank you.
So the Purple Book, just to be clear, there's only ever been one amendment, one change to the text, and that is the change that was just adopted this past May. So that's the only change that will be made to the text of the framework. We will include in the Purple Book, the same way we had the Resolution 64.5, we will include the text of the decision from the Health Assembly. But other than that, the text of the framework will be essentially the same, except for that new footnote language.
And thank you for the question about working within the UN family. We are very committed to doing so. We're keenly aware that we don't want to add to the burden of member states with questionnaires. That is why we're working in-house to see about coordinating that. But even more importantly, because this information may exist, we're working very closely with colleagues in the Secretariat for the Convention on Biological Diversity, the CBD Secretariat. And we will continue to do so, particularly with a view towards avoiding any unnecessary burden or survey questions that may be looking for information which is already available. We want to use what is available in this desk audit to make it easy for everyone. At the same time, we want to make sure that we have the best possible information that we're delivering to member states on that. And so we will, we may have to resort to some sort of some outreach on this, and we'll do so as necessary.
Okay.
Chris Bagley, please.
Good afternoon, and thank you for the opportunity. Can I preface this by saying my brain's been dulled by too many anesthetics this year. So this truly will take the dumbest of all questions. Just to get my head around, and I wasn't paying attention to WHA72 at the time, has a discussion we've had to date related solely to 7212, including operating paragraph 1b, which of course refers to Nagoya, which is the subject of 7213. Is that right? Have I got that right? Well, the brain's sharper than I thought, so that's good. And therefore, will we have a later discussion on 7213 and how you're approaching that in this webinar? No, thank you.
Maybe Dan, you can go back to Dan. No, really very, very helpful questions. Maybe we can go back to the slide with the three streams, because this really concerns, I think, a question which is very important to member states and to all the community of stakeholders about how does WHO 7212 on PIP, which mentions Nagoya, as was just mentioned, and WHO 7213, the next in line, which is about implementation of Nagoya, how do they relate? And how do we ensure that we can both deal with those issues under, as they concern the subject, PIP in general, PIP specifically, and then more generally, and avoid duplication and ensure coherence in our work. And one way we do this is by working closely with making sure these three streams touch each other. So you have the, on top, the PIP stream, on the bottom, you have the Nagoya, the 7213 stream, if you will. Top is 7212 stream, if you will. And then this all runs along the central issue because it's centered on Nagoya, and it is very important that it be understood that the center of this is maintained and held by the CBD and the CBD Secretariat. So that's why the green bar there. We will have separate information sessions for PIP, you'll see it there, and another information for Nagoya. And in each of these cases, we will be mindful of the questions and implications which could come up in the other area and how we'll address that. But this is why you heard us saying, for example, about this possible survey and working with our colleagues working on that bottom stream. So they're planning a survey and how we might participate with them in that to ease any burden that survey might impose. That's one of the things we as a Secretariat writ large are working hard to ensure that we can do.
So I think we have a number of questions that have come online, and we have another question from Dr. Jones. So perhaps we... Fantastic. So over to Dr.
Thank you. I just wanted to follow up on this intersection between the work related specifically to influenza and the broader Nagoya question. So the way I see it is that the WHA decisions this time are about how do you maintain the public health objectives in this environment where Nagoya Protocol is coming. So that's the thrust of WHO. However, as a part of that, so we're going to be continuing the work that the AG has done a lot on some of these issues that relate to it. But then the larger effort is going to be on a broader collection of pathogens. My question is, in terms of that larger work, how broadly are the pathogens? What are the pathogens in that list now? Because I think one of the challenges of this work, I mean, the influenza is somewhat narrow, but we see that's already big. We have seasonal and pandemic, and we have all kinds of issues just related to influenza. The pathogen list is very large. Have any boundaries begun to emerge about how that's going to be looked at in terms of the larger? Because I think it's quite an overwhelming number of organisms.
So indeed, thanks a lot for the question. It's indeed quite challenging. And we try to maintain the balance between a kind of a broad agreement, of a development of a broad agreement that respect indeed the public health objective within this Nagoya environment, and still being pragmatic as well, because negotiating those kind of very broad agreement covering basically all pathogens may take many years. And so what we would like is to achieve something in a reasonable amount of time, something quite pragmatic, maybe not so ambitious, but at least that allow us to work in emergencies, because we know that we will have more emergence of pathogens. Since the beginning of this century, we have had already quite a number of them. And so we need to find a way to address them, but having in mind this public health objective you mentioned. So this is a very difficult balance, actually, and we are working on this, making sure that the pragmatic objective and the more philosophical or UN-oriented objective are both maintained in focus.
So we have a number of questions that have come online. Dan is phenomenal. He has taken them all down and grouped them. So I'm going to turn the floor over to him so that he can read them to you. Over.
Sure. So we have a number of questions and a few comments as well. I've grouped them into sort of administrative matters. OP1B, there are multiple questions on that. There was a comment on the universal flu vaccine, and then one comment on OP1C. So maybe I can start with just the administrative ones. The first, many people have asked whether the slides will be shared, and the answer is yes, they will be. They'll be posted on the webpage that you use to access this webinar. And then there was a question about the November 1st consultation, and it was whether the reports that we use at that consultation will be shared with stakeholders in advance, so they have a chance to comment. So those are the two administrative.
I haven't an answer to that one yet. Yeah, the reports won't be ready at that time, but yes, as Steve just said, we can have a snapshot, and this would be an update on what we are doing. So parts of the report will be part of the updates that are provided and the information that is provided during those sessions.
All right, so we had several questions on OP1B. And the first was a response to Steve's comments. The comment was that the laws that Steve said are being reviewed are only ABS and IHR, but OP1B also requires a comprehensive review of all legislation and regulation that affects influenza virus sharing. It's not just implementing Nagoya/CBD.
Okay, well, thank you for that. And it allows me to clarify because maybe it wasn't clear. If we can go to the slide. And Dan, can I ask you, are the slides available now for those who are on the web? Okay, no, so that's, well, I think the first takeaway we can do is if we can see about maybe if the slides would be visible on the, for the next webinar, that would be. They were. Oh, great, okay, all right. So the reference to PIP and IHRs was made just because it's one of the search terms we will use, not because that will be the focus of the desk review. I should make that very clear. We'll also use as a search term some of the relevant articles of the Nagoya framework, including, I had mentioned 8B, which deals with situations of health emergencies. And that's really just as a way to ensure that we can take a deep look into the regulatory and legislative schemes. But it's by no way, I'm glad, I thank the questioner because it allows us to make clear that that is only one very small part of a much larger look at considerations of influenza and both seasonal and pandemic very, very broadly. The aim is to give member states and the broader communities that are interested in this a good feel, a mapping, if you will, of what these legislative arrangements look like, what they do, how they vary, how they are similar to each other, and what their state of development is. So I hope that answers the question.
All right, thanks, Steve, for that clarification. So the next question on OP1B is a comment first that some Nagoya Protocol countries entered into regional biobank networks through MOUs, waiving their Nagoya Protocol rights to network partners. And the question is, will these examples be taken into consideration as possible good practices?
So these will be taken into consideration in reporting on the legislative arrangements. Absolutely, that will be of keen interest, I think, to all those who are interested in this. They will not be taken into account as best practices because that's not part of the mandate to produce a best practices. It may be that member states, having reviewed all this, want to take that next step. But the selection of those and how the criteria for what might even be best practices is something which hasn't yet been developed. So this is really a harvesting and a synthesizing for accessibility function that we are doing. We're going to synthesize for accessibility so it's not just raw data for you, but to somehow make it navigatable. That's the idea.
Thanks a lot, Steve. So then the last question on OP1B is that many countries have gone through multiple iterations of their laws for the Nagoya Protocol over the last few years. Will the analysis of the legislative and regulatory activities of countries capture these changes in detail? And then there's a second part, which is, will the report discuss any implications of the various legislative language on possible access to pathogens, or just share the facts without any commentary?
So I thank the questioner for that. It sounds that's obviously a questioner who is closely following this, so that's always very appreciated. There won't be commentary. We are sharing the facts. I think I've already answered that in my previous answer. I think that in terms of the iterations, I think that would be of a resource intensity that may be more than we could do in the time allotted. I think what we would do is take the current status, that is that which is applicable, or the last draft, if you will, if it's not yet implemented, not yet in force, and work with that. But an iterative approach for each of these countries would add, well, mathematically a considerable amount to look at. So I do not think we would go that way in this short time.
So the next one, it's more of a comment on the universal influenza vaccine discussion that we had earlier. And the comment is that the advisory group should have a session on universal flu vaccine to better understand the various approaches under development. The various types of vaccines may not be universal in the way you discussed, but may be more complementary to seasonal flu, extend protection for types of seasonal, or lend some cross protection to some strains. Whether these are therefore useful for pandemic response is less clear and should be evaluated in conversations with companies and organizations undertaking the research.
So maybe our GISRIS colleagues to comment on that, if you wish, or Wenqing.
I think it's quite right that these will be used to complement pandemic vaccines. Most likely, it's the process of how, if you have a universal vaccine, what happens then to a pandemic vaccine? I mean, I think that this would be equivalent to a switch type of mechanism where the WHO have had meetings about switch, and how you complement a universal vaccine with an immediate response would need to be understood fully from the manufacturer's perspective, the national authorities that would be responsible for purchase of the vaccine or whatever, and that would have to be fitted in to the quite a complex environment, I think, on that event, on the event of a pandemic.
And I also think that the term universal, a universal vaccine may not be actually universal. So I think it depends on what is developed over the course of the next few years. So I think that's something to be taken into consideration.
Yeah, and in addition to not perhaps being fully universal in the first implementation of what is aiming towards universal vaccine, it's also the question of what does it aim to achieve, because I believe that many of the first approaches will be vaccines that are more broader, but maybe not going as far as we would wish in providing sterilizing immunity. It's more like ameliorating the situation, or like that you may get infected, but maybe you will not suffer such severe symptoms, and that for the foreseeable future, I think there is still a scope for a pandemic vaccine that is specific and is sufficiently novel that you will get a much better immune response against that than you do with some of the seasonal viruses that we see. So I think it will not suddenly, in the short term, be a situation where all our current approach will be obsolete.
Well, so just to add on that, well, the comments from the member states are absolutely right. I think what PIP framework is really about equity, or equity with regards to contributing by sharing viruses and make sure the benefits arising from the shared viruses are equally accessible to the people. Well, the current universal vaccines developed mainly still are seasonal, try to develop towards the annual vaccination or to less fewer vaccination. And if in the future that just one shot can cover both the seasonal and the pandemic, then the requirement also for virus sharing is different. So in those cases, the benefit sharing, the equity or benefit sharing is different from what we are talking about now. It is more like the access to EPI vaccines that we are talking about these days. So I think the landscape will be different at that time.
So do we have more questions? Two more from the net, and then there's Dr. Al-Busaidi and Dr. Jones after. So we'll take the last ones from the net.
So one's just a comment that we received on OP1C, which is that it would be useful to engage with stakeholders on this paragraph. And one suggestion is to have an online session and invite comments and feedback. So that was a suggestion from one of the participants. Thank you for that. And then on, we have received one additional question on OP1B while this discussion was taking place, and it was just a practical question of when this phase 2 survey will take place.
Okay, thanks. So again, we know the report will be May 2020. The phase 2 survey will hopefully take place before May 2020. The question is whether the results will be available before in time for the report in May 2020, because the report has to be prepared in order to give member states to the Health Assembly time to prepare for it, and it has to be translated. So the report really has to be finalized by beginning of April. And so there's not much time. So that's why the caveats about how much we'll be able to give you about the survey. But certainly before that, the survey should be out. And again, still an open question about how we might contribute to that survey for the purposes of OP1B. We're working with our colleagues and within WHO and our CBD colleagues, again, the very helpful point about avoiding unnecessary duplication if this information exists elsewhere, we take very much to heart.
So we have two more questions here in the room. Dr. Al-Busaidi first, and then Dr. Jones.
Thank you. If we go back to the slide where you showed the three streams. Yeah, this one. Now, the proposed survey will be targeted towards the lower part or the higher part, because in every country, these two things are in separate ministries. Thank you.
Yeah, so this ministerial question is very much on our minds, because often the legislation is handled through the ministries of agriculture and environment and not the ministries of health. And that is one of the many reasons for our close work with the CBD Secretariat. And their assistance in reaching their constituencies, as it will, with this is going to be very important for both the legislative issues that come up under OP1B and again, just to underscore that this survey we're talking about, this broader survey, would be mostly in service of the Nagoya decision, which is 7213.
Dr. Jones, please.
Thank you. I have a question about the WHA 7213, the first paragraph in that one, and the description of the report, because I recognize that the influenza work feeds into this report, which is more broadly about pathogens. But one of the things it calls for is a look at potential public health outcomes and other implications. So I think that goes beyond just the facts of what legislation are. And so I just wonder about that, because my reading of that, I would have an expectation that it would be more to me than just here's the legislation. It would be here's how it might affect in the future. So, and I think that we've had discussions that that's tricky to talk about without case studies of specific examples, but I do think there's much more than facts. At least that's the way I read that, and it would be an expectation.
Yeah, here we get into an interesting question of sort of what is for us within the Secretariat statutory interpretation of the various mandates. So we have a rather narrower mandate in OP1B, which is to give the information, and we have a rather sort of broader, with respect to a broader category, all pathogens, in the Nagoya decision, which says give us potential public health outcomes and other implications. And I think what we are very mindful of is ensuring that the expectations of member states overall are met. And we know that member states have an expectation that they are in a better position to assess how to go forward on Nagoya generally, and how to ensure the continued effectiveness of the PIP arrangement in particular. I think we're going to keep that in mind and just try to find a way to meet both mandates without exceeding either one of these mandates. That's the issue. There is some tension between the Nagoya and the PIP. I think we can address that by saying there is a good understanding across the Secretariat that one of the reasons that it was separated was member states have different views on whether a PIP-type arrangement is or is not appropriate for pathogens more broadly. So there was an interest in dealing with PIP in the existing instrument, but at the same time an instrument in dealing in learning more about Nagoya generally. So we will be fully respectful of those different views among member states. They collectively, in a consensus manner, want more information in general in both streams, and we'll work towards that.
Just as a follow-up, can you clarify where this Nagoya protocol work is now centered at WHO? What office is it in? Because I guess PIP will coordinate with that.
So it's centered in the office of the chief scientist. So we are working very closely, of course, with her and her team on this, and across the organization. And I should add that we've taken careful note of member states' collective interest expressed during the debates on both subjects, that there be coordination fully across the organization at all levels and across technical units as well. And we are very mindful of that also.
Thank you. So Dan, are there any further questions online?
We did receive a few. I haven't had a chance to categorize them, but maybe I can just read them out. There aren't too many, I think. So the first is under OP2, what is meant by public use? Okay. And then the second question is, will the information from the survey be made publicly available? Given the limitations of the ABS, clearinghouse, yeah, this would be useful. And then, yeah, the answer is that they will be made public, yes. And then there's a question about whether we could confirm the final delivery to WHA of 7212 and 7213, respectively. I'm not quite sure if you understand that, Steve. Could you please confirm the final delivery to WHA of 7212 and 7213, respectively?
The time frames are different. Yeah, the time frame. Yeah, the time frames are different. So we will have a report on under 7212, which is PIP for just using shorthand here, at the May 2020, and 7213 puts the deliverable at the 140 at the 674th World Health Assembly. So that's 2021. Looks like a follow-up.
Okay, yeah.
It is a follow-up because on your purple bit at the top, you talk about May 2020, I think, as not being a final. It's a report on progress.
Yes.
So that I read from that you might be telling them where you got to so far, but that your real end date was more likely to be the 2021, i.e. at the same time as the 7213 decisions.
Right. So and that it is correct that that is a report in a sense on the progress, because we are reporting on implementation of the PIP decision in May 2020. So there will, I think, understood, be follow-up to a report on that implementation. So it wouldn't be the final report, but it will be enough so that member states can advise on what would be useful as the next step, or what could be a more focused approach to the information they've already received. Yeah.
That's all we have right now. Did you address OP2?
So, oh, please, go ahead.
I just have one question on 1D, the databases. In that the advisory group has spent a lot of time talking about databases and had recommended language at one point for informing. And I was just wondering how you relating to this recommendation, or to this to explore, because there has been quite a bit of work done, and I was just wondering how that was going to feed into this process.
Yeah, sure. Thanks, Carrie-Ann. That's a very good question. And the answer is that we're already starting to look back at some of the stuff we did for the advisory group in the past. There's a lot of material that we've already generated, survey questions and different documents and things like that. So that will all be incorporated into the implementation of the Health Assembly decision.
Thanks. Professor Bagley, please. Chris Bagley. Oh, okay. No worries. Any other questions? But there are more online questions coming. Please, over to Dan.
All right, so on OP1B, what are we considering to be public health considerations? Will we include implications of the relevant ABS measures on influenza preparedness and response?
Oh, sorry. Sorry, what was?
No, I'll repeat it, sorry. So for OP1B, what are you considering to be public health considerations? Will you include implications of the relevant ABS measures on influenza preparedness and response?
Well, if we could go back to this slide on this, I hope in that slide, which will be published, you'll see some of the considerations that we'll be looking at in terms of the public health considerations. We're getting there. Yeah, there they are. Considerations they are there. But I think it's worth recalling, as has already been a subject of a question about the relevant ministries, that much of this legislation is going to be focusing on issues that come up in an agricultural and environmental frame, so that the public health are those things that might bear on the public health concerns, which have already been addressed in a number of ways, not least in the initial reporting that the Secretariat provided to member states on the public health implications of the Nagoya Protocol. So I think we'll be keeping in mind the work that's already been done and shared with member states and publicly on this when we consider what the public health implications are, and mindful as well that we are dealing in an area where the principal focus is in areas involving agricultural and environmental concerns.
Okay, perfect. So then another question is on OP1D. The questioner is asking, when will we know what WHO is planning to do to implement that paragraph 1D? So the answer to that is that in the coming months, we're going to develop more specificity, and that will be included also in our report to the Executive Board.
So there was a question on OP2 with respect to what is meant by public use, and I think I will read the relevant part here. Any manufacturer that enters into any contract or formal agreement with recipients or GISRIS labs for purpose of using PIP-BM on the manufacturer's behalf for commercialization, public use, or regulatory approval of that manufacturer's vaccines, diagnostics, or pharmaceuticals shall enter into an SMTA2. The term public is something that we have to work on. It's not quite defined at this point. We will have to look at what the parameters are, and we will develop something there. We'll be very transparent about it. But at this point, I don't have a definitive answer to give you on what public use is as opposed to private use. But we will do that.
And working with the advisory
Working,
group.
obviously, yes, through the advisory group and to establish what could be used there. Over to Dan, one more question.
It's not exactly a question, but more of a request that we could summarize the key inputs that are needed from member states and stakeholders. So, for example, the responses to surveys, the upcoming information sessions, things like that. Just give an overall summary. Yeah, and I wonder if maybe we could go back to the first slide and just show those key. Yeah, so there you can see a few inputs already. One is the 2 surveys that are going to be issued, and then there's the information session on 1 November. So those are the key upcoming dates in the next few months to look out for. Yeah, that's a good clarification. So one is for GISRIS labs, so that'll be sent just to GISRIS labs, and then one will be to member states and stakeholders. Thanks.
Can I clarify just on that, this slide, it has on the bottom the November 1st meeting, doesn't it? It has in yellow information session on WHA 12. Isn't that going to, it seems to me unavoidable that you have to talk about both of these decisions together. Because I do think the linkages between the ministries, as has been pointed out, but I just think, and I think that is a very big issue, would be very big issue for member states, because it would bring in a much broader amount of expertise, experience, and whatever. So I think that needs to be pointed out, because it looks now like it's narrowly with, well, it looks like, I can't tell where it's supposed to be, but I'm not sure if it's going to cover both.
Sorry, Carrie Ann, that actually, there's a typographical error there. So it should say WHA7213 in the yellow box.
And 12. It should say
Yeah, so it'll be an information session on both, but it will cover both.
Please, Dr. Mancha.
When talking about the different ministries involved, what about education? Because universities always are using biological material and probably are not on the table. And they should be.
Ministries of Education.
Education, yeah. Yeah.
That's very helpful. Thank you. Especially for the scientific community concerns, yes.
So any further questions in the room or online? Okay, then perhaps we will close this webinar with a huge thanks to all of you, both virtually, I don't know where you are, who you are, but for all of your interest and for all of you here. This has been a remarkable session for us. It has enabled us to gather a number of questions and clarify certain things. We'll be following up with the task that we've been asked to do, and thank you again very much. And we welcome any feedback on this mechanism as a tool for information sharing. Thank you.